I want to bring in Dr. Perry Wilson, an associate professor of medicine at Yale. Thank you, Dr. Perry, for joining us. So how big are these developments, not only from the Johnson & Johnson front, but also from Pfizer? Because initially we thought it was going to be so hard to transport and store these vaccines.
Yeah, this is great news. Storing a vaccine at -80 degrees Celsius is just something a lot of places, particularly rural places around the country, simply cannot do. So this just gives them more options. It gives us an easier path to work on that logistic component of getting the vaccines out. And that, combined with what we anticipate will be a new emergency use authorization for the Johnson & Johnson vaccine, just one more arrow in our quiver in the battle against coronavirus. So yeah, very good news.
You know, we heard from Dr. Fauci earlier, and he was sort of giving some rough guidance on whether or not you can see family members if both, or even friends if both of you have been vaccinated. But now we're hearing reports of people getting COVID after being vaccinated. Is that because they were infected maybe before the second dose or after the second dose? Can you kind of break down those nuances for us on how that could happen?
Sure. There's a number of ways it can happen. For one thing, you're right, the vaccine doesn't take effect immediately. There's those 2-dose vaccines to get the full efficacy. So there's a month-long period there where you're waiting between dose 1 and dose 2. And even then, it's going to build up that antibody response, and for your immune system to ramp up takes another week or so. So partly, yes, people can get infected, before their immune system is fully up and running to fight the virus. But also remember that even these really, really effective vaccines, like the Pfizer and Moderna vaccines, are not 100% effective. So, they're around 95%. So if you had 100 people who would have gotten infected, well, now you only have 5 that get infected, and that is a huge benefit, obviously, but 5 isn't 0. So, we have to remember there's no true magic bullet here. There's always some risk. But I will say that even the people who are getting infected legitimately after the entire series of vaccinations seem to have very mild disease. And that's so important to take the stress off our healthcare system as the hospitals continue to have lots of patients with coronavirus in there in their ICUs.
I think that's something that is important for us to understand, right? Like you can still get the virus, although you may not be blindsided as you would have if you didn't have at least some armor in your body. Is that right? They can still, certainly you have to be conscious and stay home and quarantine, but at the same time you may not be a cost to our healthcare system.
Exactly. All the efficacy numbers you see are based on symptomatic coronavirus infection, but that symptom can just be that you have a cough or you have some fever and you're home and otherwise fine. They're even more effective when the definition is severe coronavirus disease, disease resulting in hospitalization. And essentially, there's been no coronavirus-associated deaths in the trials in people that got the vaccine. So, they're incredibly effective at preventing that severe manifestation of the disease. And if we can just, dial back the volume on coronavirus, that's great news. But for many people, the vaccines will really protect you.
Yeah, and we've seen that 70% dip in the past 5 weeks, and now we're hearing that we could have Johnson & Johnson. So there's certainly a lot of good news in this fight that we have after a year of taking it on. Dr. Perry Wilson, thank you so much for joining us.